You're in studio, Dr. Joe Congeni, good friend of ours, Sports Medicine Center, Akron Children's Hospital. And Joe, this week, Andrew Luck, at the age of 29, steps up to the podium and says, I'm retiring. Basically, I'm tired of rehabbing. My body's not responding. I'm tired of the aches and pains as I look on down the road. Obviously, a very difficult decision for him. Take it to the medical standpoint, and maybe you deal with this type of subject to the college and maybe even the high school level. I don't know.
Yeah, I think probably your audience wouldn't realize, hey, this would be only a professional athlete thing. And that's definitely not the case. It is definitely a part of what we do. So what do sports medicine doctors do? We diagnose things as to what the injury is and the diagnosis. We put together game plans about how you treat these things in athletes. A big thing for us is return to play. When can people return? That's a tricky thing. As we found out with the Kevin Durant, just being an example of that, we face that every week. Should a kid play this week? There's several kids out there this week 1 of high school football. We're making decisions. Is this an injury they can play with or not? So return to play, number 3, is a big thing for us. But the final thing is there are a lot of people that come to us near the end of the road and they want to talk about possible end of career. Should we go on further? In the high school setting, do we talk about this? Yes, I'd say maybe once every other month we have a talk with a high schooler that, had injuries since they were in grade school and either switching sport or having to quit sport. Yes, even in high school. I'd say more often in a clinic like ours, in the population I see, a lot of college kids. A lot of college kids use us. They go off to college. They hear one thing from their medical team at the school they go to. They come home over a break or over a summer, and they want to sit down with us and say, hey, let's look at all the parameters. I'm not sure whether I want to continue on in the sport. So medically, we kind of lay it out with them. And there's really about 4 things we look at. Number one, one of the things is it a structural injury that probably isn't going to get better? So we have to image them sometimes, and we need further imaging of things like MRIs and exams to determine, does this look like something that's going to get better?
Right.
Number 2, have they failed reasonable rehab? Failed once, failed twice. Many times with kids, I can go over, okay, there's 2 or 3 options here. We can do A, B, C. They say, hey, we've done A, B, C, and none have worked. Wow, that's not a good thing. Mm-hmm. Number 3, we look at really affecting activities of daily living. So not just when they play sport, but it's starting to bother them all day long. I heard that loud and clear through Andrew Luck's talk, that this was bothering him with activities of daily living, and frequently that's the case. Or they get a little better, but as soon as they go back, they have flare-ups. And so just this past week, an hour-long talk in my office with a college athlete. She's trying to make decisions. Hey, I'm going back this weekend. Should I play? MRI was new here in August. We looked at that. We talked about that. I have no skin in the game for the team. That's why I think a lot of people come back. They knew us. They went to us in junior high and high school and ask us, hey, objectively, medically, what do we think? And really those 4 parameters that I went through is kind of what we look at.
And the mental stuff, too, with the concussions. That's a different road on this, but it's still, whether you're going to continue or not. Sometimes in the medical profession, you have to say, I imagine, not you specifically, but the profession has to say, you can't do it anymore.
Concussion is even a more intensified discussion of what we just said. It's the same kind of thing as some of the other bodily injuries, but kids will live with a little of that and, hey, down the road of what. But some of the down the road with concussion is so concerning and frightening that we're really it's more intensified. We're more concerned about it. Maybe we have it even at an earlier point, especially with all the awareness. Parents and family want to come in. We look at all the studies together. We lay them out. It may be an hour evaluation. It might be an hour and a half to discuss some of these things. And then certainly what a lot of athletes do, if they do want to continue to pursue it, they might look at second opinions, and I can get them tied up with some, national expert if they want more information. However, most of the people, they're very happy to have that medical input on making some of these decisions. And you're right, it is in the concussion world or it's in the musculoskeletal world, but these are decisions. They aren't just 29-year-old millionaires like Andrew Luck. We have these on high school kids and college athletes as well.
Very emotional too, I
bet. It's very, very, very emotional. From having kids as I do, how much kids put into this. And I say that to them emotionally, financially. They've given up a lot of things in other areas to do what they've done athletically. So it really is tough. And maybe sometimes parents and the athlete not always on the same page right off too. So sometimes I leave the room for 10 or 15 minutes and I ask them to have that discussion with parents. I'm going to come back in and you guys tell me what you're coming up with together. But it really needs to be, if a parent can't be there, if it's an out of town college athlete, I'll even get them on the phone, on a speaker phone. And I want this to be kind of a group decision, but it is a part of what we do as well. I could see kind of the angst of what Andrew Luck worked through, but it's the same kind of thing that we face in our office too. So it had a real familiar ring to me. It is one of the big things in the area of sports medicine that we do on a regular basis.
Great stuff. Thank you, Joe.
Okay. Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, live in our studio.